In the last few years, 27 states have passed laws making care for trans kids illegal. Now the presidential administration is trying to keep kids from going to the doctor in the other 23 states. And as far as they're concerned, they don't need a law to do it. We're talking here about gender-affirming care. So for most trans kids, that means therapy and puberty blockers, which hold off puberty safely so that kids have time to get to know themselves. For some older kids, it means hormones. Very rarely, it means surgery. The goal is to give kids time to prevent changes that could require intense interventions later on in their adult life. This is care that is recommended by every major medical association in the United States. Studies say it saves lives. So, what's the administration up to? NPR is reporting that the Department of Health and Human Services plans to change the rules for Medicare and Medicaid. Not only will Medicare and Medicaid stop covering gender-affirming care for kids, they'll also completely cut off any hospital or clinic that provides it. Now again, this is not a new law. Nobody voted on it. These are unilaterally imposed rules. So there's two catastrophes that this would cause. Number one, most hospitals cannot operate without Medicare and Medicaid patients. They wouldn't just have to turn poor and older people away, they would literally have to close completely. Second, much of what private insurers cover is based on what Medicare and Medicaid cover. So even private insurers might drop gender-affirming care completely, even though it's generally pretty cheap and really effective. I mean, we're talking about generic medications here that have been around forever. And like I said, saves lives. Will hospitals and clinics fight the new rules? Some probably will, and they will probably win, but it will take years. In the meantime, hospitals won't be able to get by without Medicare and Medicaid patients. Clinics will close. Doctors will be fired. The entire infrastructure of gender-affirming care will essentially be wiped off the map, which is, of course, the goal. So, ask yourself this. If your kid needed to see their doctor, how would you feel about the government saying that they couldn't?